Prepare to experience the strongest radio allowable by law. Secrets will be revealed. Myths dispelled. From the studio gym where excuses never apply, it's Superhuman Radio with your host, Carl Lenore.
Today is going to be an uplifting story, full of hope. Nowadays, when people hear the word cancer, they lose all hope. Or maybe they lose hope, but it's half-hearted that they actually hold on to hope. And hope could be one of the most important things to help you fight this battle. We're going to talk to my guest today, Dr. Diva Nagula, about his own journey of going from being a doctor to being a patient. This is going to be a wonderful interview. How has your life changed since you had this, potentially this could have killed you. It could have consumed you. It's a blood cancer. It's actually a non-Hodgkin's lymphoma, very, very dangerous cancer. How do you look at life now?
I look at it so differently now through a different lens. I have healed myself over and over again and discovered so many different things to help heal me and to also look at life totally differently than what I was looking at even before I was diagnosed with cancer. So it was actually a blessing that I actually had cancer because of the realities that have changed since actually looking at things differently and actually having an understanding of how to live a healthy life.
Do you think most physicians know how to live a healthy life?
No, 100% no. And it depends on what you qualify as a physician. If you're talking about a physician that practices the traditional Western medicine, I say no. If you are talking about a physician or a health practitioner that actually understands holistic medicine, understanding how to diagnose conditions and getting to the root cause of the problem, then I say yes. But there is a vast majority of people that are following traditional medicine versus the integrative or functional medicine where you're getting to the root cause of the problem.
And really, we have to harken back to some of the medical styles of Ayurvedic medicine and traditional Chinese medicine when we want to integrate health, because those were the styles of medicine that focused on staying healthy and not getting sick in the first place. Allopathic medicine is more of a we treat you once you're sick, go out there and do your best to figure things out on your own.
Right. And yes, and we're using, and some of the integrative approaches uses Ayurvedic medicine, traditional Chinese medicine, but it also encompasses a difference about holistic practices. We're not just looking at a specific ailment. We're looking at what is causing the ailment. So we're looking at it from a spiritual perspective, a nutrition perspective, what we put into our body. We're also looking at toxins that are prevalent in our environment. We're looking at those types of things that could have a role in a specific chronic disease that you might be having. So it's looking at the big picture, not really what if a physician does, an allopathic physician does, is just looking at a problem, looking at a number, looking at a laboratory value, and making a diagnosis and a recommendation. I was an osteopathic physician, so the difference between an osteopathic and an allopathic physician is very simple. An osteopathic physician has more of a holistic perspective in the musculoskeletal sense. So we are actually trained to do a lot of what chiropractic practitioners do. But we also have the education and knowledge of an allopathic physician. So in my eyes, it's the best of both worlds. There are cancers that are genetically predisposed, and you just got the wrong hand dealt to you, right? So that's fine. But a large majority of these cancers and chronic diseases occur because of lifestyle practices. If you get diagnosed and get treated using chemotherapy, immunotherapy, or whatever else is out there, you're not addressing all the issues of your lifestyle practices and that cause you to have the cancer. And no oncologist is going to tell you that. So your diet, your stress that you're under, the environmental toxins that you're probably encounter on a regular basis, all the personal care products that have so many chemicals that you're applying on a daily basis, all of these accumulate over time and can have a risk of causing you to have cancer or chronic disease. So that's why it's important to really look at your lifestyle practices after you've gone through chemo if you have a diagnosis of cancer. Otherwise, it's going to come back.
When we talk about inflammation, we're talking about the army of the immune system. When we talk about the immune system, we're talking about the gut, because 90% of the immune system resides in the gut. So when we talk about inflammation, we talk about gut problems. That's really where they start. But modern medicine doesn't connect those two. They treat inflammation by using analgesics and anti-inflammatories instead of addressing where why is the army of the immune system being called like there's a war when there's no war, and you'd have to look at what's going on in the gut.
So for years, when I was practicing my practice, which was a very, very high stress time of my life, and I would always have issues with my stomach. My bowel habits, I would go frequently 5, 6, 7 times a day, very loose. I would often be bloated. I would be gassy. And to be honest with you, at the time, it became the new normal for me, right? So I couldn't remember what normal was. Initially, the problem that I had was my mind was taxed. I had lived in a state of fight or flight for pretty much my entire life. So when I actually had the diagnosis of cancer, I actually gave up. My mind just basically, I had no fight left in me. And it was hard for me to give in because I'm a control person. I have to have control over the situation. And for me, going into the process of leaving my entire prognosis of my life to the medications that was being administered just didn't resonate with me. And, it was all about how to live a life that's not in fight or flight. And if you live a life where you can actually balance, your nervous system, and where you're more in parasympathetic or fight or rest and digest, it serves your body so much better. It allows you to do two things. It allows you to get out of that heightened state where all those hormones are running and cortisol levels are high, and puts us on edge. Then when we're in that state, we're causing inflammation. And mindfulness is, by definition, is moment to moment awareness without judgment. You could actually do meditation. You can do breathing exercises. You could engage in activities like yoga, tai chi. You could even do what I call is the lazy man's way of meditating, is by listening to binaural beats. And these are all strategies that really can help you to be more in a rest or digest state. But more importantly, it actually helps you to be more present with so many different strategies that you could utilize to help. And then granted, now don't get me wrong, pharmaceuticals have its role in society. And Prozac has saved thousands and thousands of lives, and I give credence to it. But there are other strategies that we can implement that don't have a bearing on our bodies and don't have interactions with other medicines or supplements or other vitamins that we're taking, and doesn't cause that dependency. And I really feel, we need to explore more of that. Spirituality is really about having a connection with the universe, having a connection with your fellow human being. That's really what spirituality it is. And it's also about, again, it's all about connection. And for me, when I was doing my book research, I wasn't even going to really talk about spirit. And then I started to do more and more research and understand that that's where a lot of my deficiencies were spiritual growth. And loneliness is actually as big of a risk factor as smoking a pack of cigarettes a day or being a chronic alcoholic. It's the same risk. It's the same risk of mortality as being obese and living a sedentary lifestyle. And a lot of things accelerated for me when I started to actually engage in psychedelics. And I talk about that in my book, and how a lot of my experiences and a lot of my issues that I had, it was like I 1 or 2 explorations of psychedelics was like years of psychotherapy.
Yes.
And it was amazing how much clarity I got and how much connection I felt to people, how much my heart opened. My heart was closed for so long. The psychedelics enhanced connections in my brain. It's called neuroplasticity.
Yeah.
And it repaired old connections that were severed, and it actually enhanced new connections from one part of the brain to the other.
How you doing, Dr. Webster? Welcome to the show, and thank you for making time to be here today. What you're exposing here is something that every woman can start doing tomorrow. We're going to talk about a study that you just published, your group published, looking at the role of meal timing as opposed to what specific foods one eats and the potential for or its implications on breast cancer. Why this study? What work had preceded this, that this study was the next logical step?
So before I start discussing that, I just want to have a disclaimer. I'm a professor at University of California, San Diego, and I'm also a senior research career scientist at the VA hospital in San Diego. So
cool.
these what I'm about to say, these are my own personal views and should not be taken as reflecting any kind of official position by either the university or the VA.
Understood.
But so basically, my group has been interested in how altered metabolism, in particular obesity, has impacts on various disease processes. So we know that obesity will affect metabolism. We know that it causes insulin resistance. It predisposes towards diabetes. But there's been an obesity cancer link that's been known for many, many years that we haven't really understood, why there's a link and then how to perhaps, manipulate that. So, most of the connection between obesity and cancer has come from sort of very large sort of observational studies where they've just shown that there's an association of obesity with various cancers. And it's actually quite a few cancers: breast cancer, liver cancer, kidney cancer, colorectal, endometrial, pancreatic. There's a lot of cancers that seem to be sensitive to your metabolic status, right? And in most cases, there's an increased risk. It can be anything up to about a twofold increased risk, depending on, particular cancer and the particular population. And we know that if people lose weight and they lose their obesity, the risk goes down. So it is definitely the being overweight that is driving this increased risk. And obesity, we know that it's a problem these days. Probably 70 to 80% of the US population is overweight, and between 40 and 50% would be classed as obese, which are, huge numbers of people. And so, we need to address what obesity is doing to our national health, because this is something we're going to have to deal with. There's a lot of people that, even though the increased risk might not be that much, with the sheer number of people that are obese, this gets to be a lot of people that have obesity-driven cancers. Some of the estimates are that there might be anything like 25,000 cancers per year are specifically, because of the obesity. So this is a large number of people that are affected by this. So, we've been interested in what's the link, how does obesity affect, initiation of tumors, how fast they grow, that kind of thing.
Can we talk about that just for a second? To
sure.
Stay with a second. So we know that fat cells. So are the obesity cancer rates, are they gender skewed by any chance? Do women tend to have higher rates of certain types of cancers than men when both groups are obese?
Well, if you look at a cancer that both men and women get, say, liver cancer or something else, then there's no real difference in the obesity effect. Yeah. Obviously, when you're talking about prostate cancer or breast cancer, that is very heavily skewed one way or the other. But it does seem to affect both men and women. One of the reasons is that after menopause, women metabolically look much more like men. So before menopause, when women still have estrogen, that tends to be protective. So they tend not to have so much of a metabolic problem with the obesity. But as soon as they hit menopause, they become just like men, and the rates of cancer and obesity are exactly the same.
Is there any indication that there might be a role of aromatase enzyme, which resides in fat cells? I mean, we hear people talking about how fat is an endocrine system, right? Well, so is muscle, but that fat is an endocrine system, and it's producing hormones. And sometimes these hormones may predispose someone to cancer, or even if it doesn't predispose, it tends to kind of fan the flames. In the case of endometrial, ovarian, breast cancers, we know that estrogen plays a role in possibly fanning the flame. Is it possible that obese women produce a lot of estrogen in their fat cells, and that could be the link to higher rates of female-related cancers?
That's one theory, yes. So particularly for breast cancer, this has been sort of proposed that you can demonstrate aromatase expression in adipose tissue. And so it's thought that there could be, local conversion of steroids into estrogen that would drive a local tumor. So, typically it doesn't change circulating levels that much. It's not like, circulating estrogens are way higher in an obese woman, but, you could have local production that could affect the cells in that vicinity, and they could see, a fairly high concentration, but kind of once it gets out into circulation, it gets diluted, and so it doesn't seem so much of an increase. So that's one possibility. And that would obviously be relevant for the hormone-dependent cancers, hormone-dependent breast cancer, prostate cancer. But others, like liver and colorectal and kidney, they're not hormone sensitive particularly, so it's unlikely that will be affecting those. And yet they still have an obesity-driven component.
So the other component of obesity and carrying lots of adipose tissue is it upregulates inflammatory markers, right? Inflammatory cytokines, and so the more fat cells you have, the more inflammation you have, and there is some indication that perhaps inflammation is maybe the first domino that causes these oncogenes to turn on and shift to a cancer environment. Could it just be that? Could it be that the fat cells are just making all this inflammation, and we know inflammation is bad for everything?
That's another possibility, and there is some evidence for that. Not necessarily in breast cancer and others, but for example, in lung cancer. So there was an interesting finding from a cardiovascular trial where they're using an anti-IL-1 beta blocker because they thought it would have cardiovascular effects. And the one thing they noticed is that the people on this IL-1 beta blocker did not get lung cancer. And so all of a sudden, there's this very strong link now between IL-1 beta, which is an inflammatory cytokine, driving lung cancer. So you're right. I think that these inflammatory cytokines, they modify, the local microenvironment. They cause, an influx of inflammatory cells. They cause oxidative damage, and they may, contribute to that sort of initiation, those first oncogenic effects. That where the cell picks up mutations that allow it to start growing, and they may actually contribute to sort of the later growth, by providing a blood supply, because tumors need a blood supply if they're going to grow, and some of these cytokines can have angiogenic properties. So yeah, that is a possibility, and we've kind of looked at that in some of our studies. A few years ago, we were looking at obesity-driven breast cancer, and we were looking at whether you could use a fish oil supplementation to block that. And in fact, it did. It worked really well, and that the obesity effect to drive the cancers was completely eliminated when we gave them high levels of fish oil. Now, these are really high levels. This would be very difficult to achieve, for humans in a diet, but it did show proof of principle that these things will work, and they are known to improve inflammation, suppress inflammation. The interesting thing we found is when we did this in the mice with the tumors, that the ability of these fatty acids to suppress the inflammation was completely overridden when you had a tumor there. It seemed like the tumor was driving a much stronger inflammatory effect than the fatty acids, the omega-3s, could overcome. So we didn't see an improvement there. And in fact, when we used it was a therapy, etanercept, or Enbrel, which is used in a lot of people, it's a TNF blocker. We used that to block the inflammation and actually did nothing to the tumor growth.
Interesting.
So in our hands, in our models, it actually seems to be more linked to the insulin levels, the hyperinsulinemia that's in the diabetes, rather than the inflammation. So that was actually kind of one of the reasons we designed this recent trial, because we thought that, we know that if you can improve metabolism, reduce the hyperinsulinemia, make animals less insulin resistant, that the tumors will not grow as quickly. So the one way that you can do that is with this timed eating, and there's a number of groups, and particularly Sachin Pandas and a couple of others, who've done a lot of work on this. When you eat, not what you eat, is important. So you can eat a very caloric, high-fat diet, high cholesterol diet, but as long as you limit when you eat it, and you have a good period of fasting without eating, that's actually beneficial and can sort of overcome the effect of the diet.
You can be healthy today, but if you're eating late into the evening, you're staying up at 10, 11, 12 o'clock watching Jimmy Kimmel, and you're eating food, and you're getting 5 hours sleep, you're getting up in the morning, and you're downing all the coffee you can to get started, and then you're eating all day long, you may be healthy for a little while when we take that snapshot. But like the guy who jumped off the building, when you hit the ground, you're going to die, and that's going to happen. So I just want to put that out there. I just want to put
that's very true. And when we talk about this, we talk about metabolically healthy, but that doesn't mean obesity is not doing all sorts of other things.
Right.
So it's doing terrible things to your joints, with the extra weight that you're carrying around for 60 years. So obesity has all sorts of other effects, but metabolically there has been this issue is maybe, in terms of how your body handles glucose and nutrition, you could actually look, pretty okay, even though you are obese. But I agree that obesity has many, many other bad things, and people should not think all of a sudden that, oh, I'm fine.
I'm fine. I can stay this way. I just have to change the way I eat, or the time that I eat. That should not be the message. So let's talk more. So how did you look at the effect on the tumors, the breast tumors? Talk about that.
Well, so we did a number of different models. So the effect of obesity on breast cancer is mainly in postmenopausal women. So we used two different models of postmenopausal obesity in mice. One was basically an ovaryectomy. We took out their ovaries. And the other was a chemically induced model. So there's a model, you can give them a chemical toxin that basically kills the follicles, the primary and the primordial follicles in the ovary. And so over a period of about 10 weeks, the mice will actually go through what looks like a menopause, where their ovaries stop producing steroids. So we used two different models, and then we used a hormone-dependent breast cancer, so an estrogen and progesterone receptor positive tumor. And we also used a triple negative one, which is not generally hormone sensitive.
Yeah, that was good. That's very good that you used both of those models.
And both of them were inhibited by putting them on the time